General diagnosis of face: yellow complexion, black complexion, puffiness of the face. Yellow complexion is a reflection of a damp stagnancy due to a spleen deficiency. When the spleen, which rules transformation and transportation, experiences dysfunction in transportation, water and dampness cannot be vaporized. And when the spleen fails in its function of transformation due to a spleen deficiency, nutrient essence cannot be transformed into the qi and blood to nourish the skin, turning the skin yellow. A pale complexion and haggard look indicates a spleen and stomach qi deficiency. Yellow complexion and puffiness indicate a dysfunction of the spleen in transportation, resulting in the retention of pathogenous dampness in the body. An orange-yellow complexion indicates retention of damp heat in the body. A yellow complexion with a smoky dark tinge indicate a cold dampness obstruction. Example, cold dampness, stagnation, obstructing the flow of blood. Black complexion. Black is the color of the hyperactivity of water and exuberance of yin cold. Deficiency and decline of kidney yang results in fluid retention syndrome, leading to failure in transformation. Therefore, yin and cold builds in the body, leading to failure of blood, the condition of the intense stability to the black. A black complexion with a yellow tinge that is dull and lusterless indicates deficiency of kidney yang, clinically characterized as cold with symptoms such as aversion to cold and cold limbs or soreness and aching of the lower back and knees. A burnt black complexion with dryness, loss of head hair, and shaky teeth indicates an overconsumption of kidney essence. This is often related to a congenital insufficiency, prolonged illness, or excessive sexual activity. Dark rings surrounding the eyes indicate water diffusion due to kidney deficiency. Deficiency of kidney essence and kidney yang results in failure in qi transformation, leading to diffusion of water in the body. The most common symptoms are edema in the lower extremities in particular, scanty urine, tinnitus, and sore and weakened lower back and knees. A black complexion, rough skin, and thirst with no desire to drink indicate a cold obstruction leading to stasis. Example, pathogenic cold attacks the body, resulting in the obstruction of yang. The symptoms are severe chills, no perspiration, and pain in the head and body or chest and abdomen. In addition to observing the facial complexion, physical changes in the face also reveal the health status of the interior of the human body. If the face lacks radiance and moisture and the skin is rough with many spots, this generally originates from the dysfunction of the 5 Zhang organs. Puffiness of the face. This type of puffiness is caused by the obstruction of blood circulation due to the retention of too much water in the face. Usually, one of the symptoms of some chronic diseases, puffiness of the face, includes both emphysema and edema. The former is due to qi deficiency and the latter to water retention. Edema is more problematic than emphysema and it requires more attention. Puffiness, pale complexion, and shortness of breath indicate a deficiency of lung qi. Symptoms include feeble, weak, coughing, shortness of breath, and panting that worsens with movement. Clear, watery sputum, a low voice, spontaneous sweats, aversion to wind, and a pale tongue texture. Localized swelling in the face indicates a deficiency of spleen yang. Deficiency and decline of spleen yang lead to the failure of spleen's warming and transportation function. Common symptoms include fullness of the stomach even when not eating much, abdominal pain with a preference for warmth and pressure, aversion to cold and cold limbs, loose stool, edema in the lower limbs, or increased vaginal discharge in women. Localized red swelling on the face is often the result of an allergy. A bloated face and body may suggest diseases of the kidneys or the heart. Thank you for your attention.